appears ordinary till you see the core side of it.
And what you're looking for is the story behind the news.
We bring it to you from Lagos, the commercial capital of Nigeria.
Giving you all sides and political stories round the clock.
Every detail from the start line to the final whistle.
CoreTV News, expanding your view.
Hello there, you're welcome to CoreTV News on the Hour with me, Sabena Izuku. The federal government has lifted the ban placed on residency training at all federal hospitals nationwide. It has also denied the reinstatement of all resident doctors who were disengaged as a result of the action. Health Minister Oyebuchi Chukwu says that all chief medical directors and medical directors of the training centers have been directed to issue letters of reinstatement to the resident doctors to enable them resume work immediately. He, however, added that the appraisal of the residency program is still ongoing with a view to making it better. It will be recalled that few days after calling off their nationwide strikes, doctors had complained that the government had not withdrawn the suspension circular. Niger's head of parliament, who faces questioning in a probe into international baby trafficking, has left the country in opposition, officials says. Haman Amadu is suspected of complicity in the trafficking of babies born in Nigeria and trafficked into Niger via Benin. But Amadu, who is considered the leading challenger to President Mahamadou Issoufou ahead of elections in 2016, has denounced the charges as politically motivated and says they would involve a breach of his parliamentary immunity. Hamadou Ben Omar, a member of the Parliament's Political Bureau, which authorized the investigation, says Amadou must make himself available to the judicial authorities. 17 people, 12 of them women, were arrested in June for their suspected involvement in a baby trafficking ring between Nigeria, Benin, and Niger. One of the Amadou's wife is among the 17 people. The alleged crime involves forging and altering birth certificates to switch the names of mothers. Cases in which mothers give out babies born from rape have been reported at such clinics, but young women facing unwanted pregnancies are more common among the Nigerian authorities. Niger has the highest birth rate in the world, an average of 7.6 children per woman. Nigeria has recorded a new death from Ebola in Port Harcourt, Rivers State, the latest casualty according to the nation's health authorities, as a doctor who treated one of the primary contacts of the late Patrick Sawyer. This brings to 16 the number of Ebola cases in Nigeria, but 70 people are under surveillance in the Rivers State capital alone. The report.
It's only a few days after Nigeria's efforts at containing Ebola had received rave reviews. But now, that enthusiasm has been dampened with the spread of the virus to Port Harcourt, the hub of Nigeria's oil industry. Health Minister says the first confirmed case outside Lagos was a doctor who treated one of the primary contacts.
This primary contact of Mr. Sawyers had evaded our surveillance team in the last week of July 2014 and traveled out of Lagos to Port Harcourt, where, as we now understand, he consulted with a doctor and was apparently treated for some symptoms. A few days later, 5 days later, following a manhunt for him, he returned to Lagos, by which time he was found to be without symptoms. Following the report of his death by the doctor's widow, the next day, that Saturday when the report came to us, the case has since been thoroughly investigated, and laboratory analysis showed that the doctor died from Ebola virus disease.
The minister disclosed that 70 people are under surveillance in Port Harcourt, but urged residents not to panic.
The Incident Management Committee has already deployed a very strong team. They are already on ground in Port Harcourt to work with the health authorities of Rivers State. I've also had a series of discussions with the authorities in Rivers State. But then, just like the situation has effectively been managed in Lagos and Enugu, the situation in Port Harcourt will also similarly be effectively managed.
This is the second time that a primary contact traveled outside of Lagos, and it's not surprising that the authorities are concerned.
In Enugu, we have 6. In Port Harcourt, we have 70. In Lagos, we have 141. But 200, since we started this journey of Ebola virus disease in Nigeria, 200 people had completed, 200 contacts had completed their 21 days, and we are no longer tracking them. So 200 had completed, we are no longer tracking them, but as of today, 141 in Lagos, 70 in Port Harcourt, 6 in Enugu.
He added that the 6 secondary contacts under surveillance in Enugu are due for review in a few days. And in spite of what seems like a setback, the Nigerian authorities say the experience gathered in Lagos will be used to contain the disease in Port Harcourt.
The Rivers State government has identified the lone Ebola casualties in the state. He is Ike Enemu, the doctor that attended the ECOWAS staff, who was one of the primary contacts of the late Liberian American Patrick Sawyer. The doctor was said to have treated the diplomats of Ebola symptoms in a hotel in Port Harcourt. Rivers State government has also placed 100 people on surveillance, including contacts from the hotel, the doctor's patients, and the patients of the hospital where Enemu was treated before his death. The ECOWAS staff who took Ebola to Port Harcourt was initially placed under surveillance in Lagos before to seek an alternative treatment. In an effort to complement measures taken by the federal and state government to contain the spread of Ebola virus, the Association of Medical Laboratory Scientists of Nigeria organized a sensitization workshop for health workers. The workshop, held at the Lautech Teaching Hospital, Osogbo, was described as timely, especially for those handling blood samples from infected patients who are more vulnerable to contracting the disease. Rashid has more on this report.
For an Ebola patient to be properly diagnosed, a science laboratory test must be carried out on the blood. This leaves the medical laboratory worker at a high risk of contracting the deadly disease than any other individual. To ensure that its members have a proper understanding on how to handle blood samples from suspected Ebola cases, Association of Medical Laboratory Scientists of Nigeria, Lautech chapter, held a sensitization program in Osogbo, the Osun State capital. The chairman of the union, Adeyeye Adetunji, says the program is necessary because of the exposure of laboratory scientists to the Ebola danger.
Medical laboratory scientists evidently play a role in the diagnosis and monitoring treatment of various diseases affecting human populations. In the prevailing circumstance, health workers have been identified as being at greater risk of contracting the Ebola virus, as they are the ones daily taking care of the patients already affected by the disease.
When we are talking about Ebola, it's just one of the threats that we have in hospital workplace or hospital workstation, especially laboratory this time around.
In his lecture, the head of medical laboratory services at Lautech Osogbo, Musa Muibi, stressed the need for laboratory scientists to apply the standard safety precautions in laboratories to make them safe from Ebola and any other deadly virus.
Don't say because a sample is labeled Ebola. I mean, a patient is a suspected Ebola case, that's why they have sent the sample. They may send another sample of whom have not manifested any symptoms of Ebola for common pregnancy tests. If that person is Ebola positive, his urine is infectious. So it is the message for all laboratory personnel is that at all the time, continue to observe universal safety precautions.
Participants and laboratory students speak on the impact of the sensitization.
I have learned that Ebola can only be transferred from patients who have shown symptoms of the virus. And you get Ebola from body fluids, you don't just get it from body contact. And I've also learned that as scientists that are going to be taking body fluids and carrying out tests in the lab, there are universal safety procedures that should be followed in order to prevent loss of life through tests done in the laboratories.
With the newly recorded cases of Ebola, it is pertinent for all hands to be on deck in fighting the scourge. Rashid, CoreTV News, Oshobo.
The United Nations has commended Nigeria for successfully containing the Ebola virus disease. Especially envoy of the UN Secretary General David Navarro delivered the message at a meeting with President Goodluck Jonathan. The president, in his response, praised the Lagos state government for teaming up with the Federal Ministry of Health to stem the threat posed by Ebola. Jonathan assured the UN Special Envoy that in spite of seeming success of its containment measures, the federal government will remain vigilant to guard against further cases of Ebola in the country. The meeting also provided an opportunity for the president to condemn discrimination against Nigerians by some countries over recent cases of the disease in the country. President Goodluck Jonathan argued that there was no justification to stigmatize Nigerians since the virus had been effectively contained and never attained epidemic levels. Head of the United States top public health body, Tim Frieder, says Ebola epidemic in Liberia is set to get worse and many cases of deadly disease are not included in the official tally. Region through West Africa with 624 deaths, 1,082 cases since the start of the year. Frieder met President Ellen Johnson Sirleaf to discuss the ways of combating
throughout
the
Liberia
epidemic.
for the last few days, talking to patients, healthcare workers, government workers, community leaders, and others. The situation with Ebola in Liberia today is dire. There is need for urgent action. The world has never seen an outbreak of Ebola like this. Unfortunately, not only are the numbers large, but we know that there are many more cases than have been diagnosed and reported, and that cases are increasing. I wish I didn't have to say this, but it is going to get worse before it gets better. At the same time, I've been very impressed by the response that I have seen. All of Liberia needs to come together to stop Ebola. It's not going to be easy. It's not going to be quick.
The death toll from the Ebola outbreak raging through West Africa has passed 1,500 mark, while the number of cases has soared past 3,000, according to the World Health Organization. The World Health Organization says a total of 1,552 people had died in Guinea, Liberia, Sierra Leone, and Nigeria from the epidemic that reared its head at the beginning of the year, while 3,062 had become infected. Guinea has 648 cases, including 430 deaths, while Sierra Leone has seen 1,026 cases and 422 deaths. Nigeria has so far counted 1,378 cases and 394 deaths, while Nigeria has seen 17 cases and 6 deaths, according to the World Health Organization. We'll take a short break, and when we return, CoreTV News on the Hour continues. Stay with us.
You can now watch CoreTV News live from anywhere in the world on our website, www.coretvnews.com. Click on Live TV on our website and watch us live.
And welcome to CoreTV Primetime Days.
To follow us on Twitter, click on Twitter icon on our website. And Facebook, click on the Facebook and YouTube to see all our previous news production. You can also watch us live on YouTube. Click CoreTV, leave a space, then news. CoreTV News, a 24-hour news station.
The United States has assured Nigeria of support towards a violence-free general election in 2015. American Ambassador to Nigeria James Edswell disclosed this during a visit to the leadership of the All Progressive Congress in Abuja. He expressed concern over the security of electorates in the Northeast as general elections draw close. Edswell says Nigeria can have a peaceful election if politicians agree to work for peace. Some governorship aspirants under the platform of the ruling People's Democratic Party in Adamawa State have asked the party not to grant waiver to Nuhu Ribadu and others who seek to contest the party's primary. The petition was submitted at the party's national headquarters in Abuja. Apart from Ribadu, other aspirants, the petitioners asked to be denied waiver are Mohammed Modibo, Marcus Gundiri, Buba Mawa, and Aliyu Kama. The 7 aspirants who signed the petition are Umar Ado, Ahmed Gulak, James Bakar, Andra Wusa Sawa, Abubakar, Halilu Giri, Idi Hong, and Awal Tuko. The petition was sent to the chairman of the waiver panel and the party national organization secretary, Abubakar Mustafa. Was titled Objection to Granting of Waivers for the Purpose of Contesting the People's Democratic Party's governorship primaries in Adamawa State for the forthcoming October 11th by-election. The petitioners argue that Ribadu, Gunduri, and Mudibo joined the People's Democratic Party for the first time only recently, while Mawa and Kalma returned to the PDP less than 2 years ago. Ribadu, in his reaction, says those huffing and buffing over his entrance into the governorship race portray themselves as empty shells that they are. Ralph Inwonye has emerged the new deputy governor of Enugu State. The office had become vacant after Sunday Onyebuchi was impeached by members of the Enugu State House of Assembly on Tuesday. The new deputy governor, a clergy of Christ Ascension Church, was screened and cleared by the House of Assembly following his nomination by Governor Sullivan Chime. After the House had returned from a short break during Thursday's plenary session, the Speaker, Eugene Odo, read a letter forwarded to the lawmaker by the governor, urging them to expeditiously consider and approve Inwonye's nomination. The break was occasioned by the receipt of the letter. After the letter had been read, the leader of the House, Ude Okoye, seconded by the deputy governor, John Ukuta, moved motions for the immediate acceptance and consideration of the letter and for the nominee's screening. Inwonye was then ushered into the chambers of the House of Screening, but he ended up just taking a bow after a lawmaker, John Anichuku, pleaded with his colleagues that the reverend gentleman standing before them be allowed to take a bow and leave the chambers. President Goodluck Jonathan has launched a multi-purpose national electronic ID card. Speaking out the former launch in Abuja, the president says the target is to ensure that over 100 million cards are issued. President Goodluck Jonathan received his own electronic ID card at the occasion and pointed out that it would make it easier for ordinary Nigerians to benefit from the government policies.
This card, every Nigerian must get. If you take the issue of subsidy of transport, what we do subsidizing hydrocarbons does not go to the ordinary people. Government spends huge sums of money, hundreds of billions of naira every year in the budget, as the National Assembly, sometimes always controversial, subsidizing kerosene. Kerosene is going very high in the market, subsidizing PMS and so on. We are thinking about how do we subsidize transport of the person going to school, person going to the market, person moving from Lagos to Enugu or Lagos to Kano, not paying subsidy, that 50% of that will be smuggled out of the country. When the issue of the crisis in the north came up, we come up with the idea, Mr. President, how do we do some bit of something that takes the shape of amnesty? There's amnesty in the South or Niger Delta. How do we do amnesty? I said, look, we must not wait for youth to carry arms against the state before we help them. We are working to the extent that as long as we have the identity, governments will be able to directly, just like the coordinating minister of the economy attempted to explain to us, to find a way of making life more meaningful. We can't do that when you don't know who is who, because the money goes to the wrong hands. And those who use this money to create more problems, even for the very poor people they're exploiting. So I'm quite pleased today. In fact, with NIMS's success story, as a nation, we are moving.
All right, we were ready. We'll take a short break, and when we return, we'll take you outside Nigeria. Stay with us.
From the capital markets, we bring information on stock market reports, talk about GDP and economic growth, showcase entrepreneurs and startups, bring on financial experts to analyze and share the views on financial issues affecting the economy. On Business Weekly, we bring business to you.
Welcome back. The United Nations says the conflict in eastern Ukraine has killed nearly 2,600 people since mid-April, saying the sharp increase is as a result of fighting in densely populated areas between Kiev's army and pro-Russian rebels.
The current number of killed is 2,593 confirmed deaths, which is close to 3,000 if we include the 298 victims of the MH17 plane crash, which we especially disturbing is the alleged increase in participation of foreign fighters in hostilities.
British Prime Minister David Cameron has urged Scottish people to reject independence in a rare speech in Glasgow, in which he says the argued union is a strong economic advantage. Cameron says the union between Scotland and England is the greatest merge in history as he addressed a conference of Confederation of British Industry in Glasgow. Most opinion polls currently suggest a proposal which would end more than 300 years of union with the rest of the United Kingdom is set to be rejected.
Opportunities that brought our nations together in 1707, the greatest merger in history. 3 centuries on, our union and our prosperity are still closely bound. Business could become tougher, trade could become more costly and complex, jobs could become harder to find. So my case is this: our single market is one of our union's greatest advantages. If we stay together, Scottish businesses have better opportunities, Scottish consumers have more choice, Scottish people have more secure jobs. Why put all those great advantages at risk by going into the great unknown? In a fast-moving world, with the rise of new economies in China, Malaysia, Brazil, size does matter. That size, the sheer scale of our union, gives Scottish businesses a government that fights for them around the globe. I would argue in Scottish business today you have the best of both worlds.
And that's it on the news on the hour. Please do join us at the top of the hour for more. Thank you very much indeed for watching.